And now I want to pull the cord while it's still wet. So I pull the cord very, very slowly and while it's wet. Those are two key aspects of the cord removal. All right, so our patient has had the cord placed for about 5 minutes, and now we're going to prepare the lower right quadrant for our scan. The first thing that we're going to do is saliva eject or suction as much fluids and saliva as we can. I'll also use an air syringe to kind of blow off any excess fluids over the adjacent teeth first. I don't worry about the prep right now. I actually want the prep to remain hydrated, the cord to stay hydrated, so there's less of a risk of any bleeding during the removal. And then we're going to place any of our isolation aids like cotton rolls or dry angles within the lingual vestibule and the buccal vestibule to help absorb any fluids during the scan. So again, the first thing we'll do, usually during the time the cord has been sitting there for that retraction, a lot of saliva accumulation can occur, so we try to saliva eject or suction as much as we can. And then I'll use the air syringe just over the adjacent teeth to push off any excess fluids in those areas. Once that's done, then we'll place a cotton roll within the lingual vestibule. So depending on the space, usually one, but sometimes you can get two in there. And this again will help with the absorption of any fluids, and also it helps to retract the tongue, kind of keeping that out of the way, because we do want to keep an eye on the soft tissues surrounding the area we're scanning, because that could interfere with the accuracy of our scan. Once I place the cotton rolls on this lower quadrant, I won't really worry about anything on the buccal side, on the cheek side. So I'm just using a mirror to help retract this area. And now I want to pull the cord while it's still wet. So I pull the cord very, very slowly and while it's wet. Those are two key aspects of the cord removal at this point to help minimize any bleeding during the removal or post-removal.